We have a bit of a change of plans right now for the Safety 101. Mojan Mataresi was supposed to do this presentation, but unfortunately, there was a last minute cancellation due to things that came up. So Mo is going to take her spot, and we're going to do something a little different and do this as a fireside chat. So, Mo, thank you so much for agreeing to participate in this. And before I start asking you safety questions, would you mind introducing who you are and what you do?
Hey everyone, my name is Mohammed. You can call me Mo from Mo Skin Lab, of course. You know me on Instagram. I am a pharmacist, a toxicologist, and safety assessor. I do science communication for the past 4 years, covering the topics like safety of cosmetics, toxicology, ingredients, and sometimes formulation.
So, I guess just to get into it, I feel like it makes sense to start with what does safety mean from your point of view?
When we want to talk about safety as a concept, there is no generalized or harmonized definition for this concept. It depends as a result or the conclusion of the safety assessment of the product. That if you follow the regulations and the rules of each countries and you produce the product matching those rules, you will have a safe product. So for the brand, a safe product is a product that matches the regulation, is compliant with the regulation, and as a result, technically it will be safe.
For brands thinking about, well, how do I go and substantiate safety? What are some of the tests that might be required of me? Another generalized question, but maybe what are some fundamental tests from your point of view that every brand should be doing when they are developing a product and putting a product onto a market?
It depends again on the market. The testing in general, for example, we have the stability testing and microbiology testing, the challenge testing, for example, and compatibility testing. Those are the most in common between the US and the EU, which are considered one of the main markets for cosmetic product. For stability testing, it helps to evaluate how the product will age with time, describe the physical and chemical and also microbiological characteristic of that product. And when it comes to microbiological testing for this product, this test will assess the level and type of the microorganism that may be presented in the cosmetic product. And the challenge testing is another test that I would consider very important, is to help the brand assess if the product actually is going to be able to be challenged with contamination when it comes to different microorganisms. If that preservative system is good enough for repeated contamination. And lastly, the compatibility testing tests the formula itself with the packaging, if it's a plastic, if it's a glass, and this test is quite important as well. That can help with stability of the whole product itself. And also, it is important to repeat the test if any type or ingredient in the formula is changed or the packaging is changed.
Microbial contamination is one of the biggest health concerns for products. And so, this is why we do this testing. If a product isn't stable, then you have no idea what's going to happen. If your preservative system isn't robust enough, you have no idea. You have no idea, and therefore, you might be putting an unsafe product onto the market. What is the role of a safety assessor in product development to ensure brands are doing the right thing?
The safety assessor is the responsible person when it comes to creating a very important document, what we call it the product information file, the PIF, both in the EU and also in the UK. In the US, it's a little bit of a different story. Safety assessor is responsible for creating the cosmetic product safety report, which is a very important part of the actual product information file, and it contains the information about the product itself, general description, the physiochemical properties of the formula, the ingredients, what type of preservative is used. And it also contains a section that contains the toxicological data of each of the ingredient used in the formula. For the second section is actually the safety assessment itself for the formula as whole, matching each ingredient with the regulation that is done again by the independent bodies for the specific market. And lastly, contain any possible information about potential undesired effect. All of this is the responsibility of the safety assessor. And all of this information needs to be ready in the EU, for example, needs to be ready before the product is marketed. So if there is any type of, let's say, possible undesirable effect, it can be immediately, we can go back to this type of documentation and see if those are predicted or it's something different that needs serious action. And for example, a recall, a warning by the brand, or a changing of the packaging, telling the consumer to use the product in a different way to reduce this risk.
And then what's the role of cosmeticovigilance? Oh my gosh, I've had to say this word a few times on air, and I've butchered it every single time. And then also for brands for reporting safety, reporting adverse effects from their products, keeping track of what's happening. What's going on with all of that?
Yes, it's a very important, I would say, system to report and detect any possible adverse effect. Let's talk about the EU first, then the US. In the EU, it is mandatory. The EU has a great system for this type of concept. They create a full document that is very complicated. So if it's available online for anyone to check and have a look at it, what they do is that if there is any type of undesirable effect popping up, reported by, for example, a distributor, a single report from a medical professional, or actually the competent authority of that market reporting this type of information, they have what we call the causality assessment, which is a whole protocol of 6 points with a lot of tables to create scores to see if this actual undesired effect is actually matching those, let's say, requirements, and then the action will be taken. So there is a complete system between the industry itself, the distributor, and the responsible person of the brand communicating all together to maintaining the safety of the product. When it comes to the US, before the update of the regulation MOCRA, it was not mandatory. It was more related to self-reporting and self-regulation for the consumer to report or the distributor to report to the FDA, and the FDA can then collect information and ask for a voluntary recall. But after the update, actually, this update gives the FDA the power to do a mandatory recall if the brand decide not to do the voluntary recall, and ask them to recall this product if the information and the data suggest that this product may cause a risk or a harm to the consumer.
I guess I'll ask some more juicy questions. What are some common mistakes that you've seen brands make when it comes to safety?
There is a lot, to be honest with you, when it comes to mistake that possible brands can do, is actually just going easy with the regulation when it comes to the safety of the product. So for the brand to create a product that is actually going to give them the good image in the market, sometimes brands cut corners, like they don't do the risk assessment, which is not mandatory depending on the market, of course, because we cannot generalize. Depending on the market, they might cut corners because risk assessment can cost a little bit of money, or creating the safety report for the cosmetic product. And when a problem pops up, they don't have what is the base to go back to see if this formula is actually able or predicted to cause this type of adverse effect. This is one of the most, I would say, problems that brands can face. Also, can the brand go to a manufacturer to create the formula itself? They can go to not very reliable manufacturer and create formulation that are, again, cutting corners when it comes to stability testing, the challenge testing, compatibility testing. All of those can be not done perfectly, or go to a lab that is not GMP. All of those are actually present, and there are cases. And because the regulations and the competent authorities show that, okay, a product is being recalled for contamination, for the big, this is an evidence showing us that actually these kind of mistakes are happening.
Yeah, I think a lot of people want to rush to market. When I talk to many indie brands, especially those who are just getting started, their expectations for timelines sometimes are like You need to think about that a little bit more. Like 3 months. It takes like it takes like 3 months just to do some basic stability testing, and that is basic. So you should be thinking more about like 2 years. But I've seen products, so companies will launch their products prior to the stability testing being completed, and then oh shoot, this salicylic acid is crystallizing out of solution. What's happening?
Exactly. This is what I mean by cutting corners. Like, okay, we are doing this stability testing, but the product needs to hit the market, which is not ideal at all.
And then on the flip side to this question, do you have any top tips that you would want brands to think about as they are navigating safety?
My top advice would be the brand is just go easy. Like, don't, like you said, the point that you mentioned earlier, don't rush it because if the product, especially in the US market, if the product cause any type of safety concern to the consumer, filing a case is super easy because the spirit of law in the US is different than the EU. In the EU is mainly based on safety and assurance that the product is safe. In the US is more about freedom and productivity, that okay, we allow the brand a little bit of space to wiggle, but they have to self-regulate themselves, make sure that our product will not pose any type of risk. The second point is don't cut corners when it comes to safety by not assigning or hiring, like I would say, a safety assessor, a toxicologist that help the brand while the product is being developed, understanding the potential risk. Because if the brand have the information for potential undesirable effect, the action of the brand to minimize the damage is way faster, because okay, we are predicting irritation, so if there is an irritation happening, we can understand that it is a possibility, so the brand doesn't have to do evaluation that our product is actually the cause of this reaction, so they can react way faster.
Do you have any final take homes that you want to leave our audience with? And also, where can our audience learn more about the work that you're doing? And also, if they have questions, where they direct their questions?
So my final takeaway is for the consumer to understand that most brands are doing their best to produce a safe product. The very famous EU versus USA regulation that EU is safer or USA is less safe is not a thing, because most brands, they when they try to launch locally, they have the goal to expand internationally, and when they do, they have to match each regulatory framework they want for the market they want to sell in. And for the second part of the question, they can find me on Instagram mostly. I am mostly active on Instagram at MoSkinLab, and also on YouTube. So if they leave a comment, a DM, I tried my best with the DMs for Instagram, but Instagram is so glitchy when it comes to DMs, to be honest. Also in the comments they can, or the comments on YouTube, I try my best to answer them as fast as possible.
And maybe I'll just quick say before I end this, it's really helpful when you just ask in comments rather than DMs, because then other people can see the answers and it's not just for you. And then it also helps the SciCommers because it adds more engagement. It helps them in the algorithm for social media. So when you have questions, comment. Thank you so much, Mo, for agreeing to do this.
My pleasure, my pleasure.